Hey, what's up, guys? This is the EMS COVID-19 response guide from Blacksburg Rescue and surrounding areas, any other agencies that are using this. So if you are watching this and it is anything past March 23rd, then you do want to go online and check to see the most current version of this document. It changes regularly, so go to bit.ly/COVID-EMS, and that's going to get you to the most current version of this document. You can also pull out your smartphone and just hold the camera over that QR code. It's going to pop up with a link to get you to the current version of this document as well. All right, so what is this provider thing that we're talking about? This is before you show up to work or before you show up to duty or your shift or to respond to a call. These are some things that you need to be sure of so that you're not putting other people, other patients, other providers at risk. All right, so by showing up, by responding, by going to work, by going to duty, you are attesting that all of these things apply. All right, so number one is that you have seen the current version of this because, again, it changes regularly. So if you're just using an old version, you might be using old recommendations. So check the current version. Next, that you have been self-monitoring your own health at your house. Before coming to work, you've made sure that you're not sick, and you're saying that you're not. Next up is that I certify that all of the criteria listed here are valid or true. And in the event that this changes during your shift, then you're going to put a mask on, wash your hands, isolate yourself, and notify your supervisor or your infection control officer. So if you're going along and you feel fine right now, but later in your shift you start to feel bad, you start to cough, you come down with a fever, whatever, put a mask on, wash your hands, isolate yourself, and let someone know. Most likely they're going to tell you to go home and follow up appropriately depending on what the situation is. All right, so what are the things that we are looking for? First off, in the last 24 hours, if you have either had a fever, so you've had a fever over 100, or you felt like you had a fever, so maybe you didn't have a thermometer, you couldn't check it, but you felt like you had a fever, in the last 24 hours, you should not go to work. If you've had a cough, then in the last 24 hours, then you should not be going to your duty or your shift. Now with cough, that's a little bit complicated because if it's just like the occasional, like throat clearing or something like that because you have allergies, that doesn't really count here. So if you have like a real true cough, then that's what we're talking about. If you scroll down to the bottom here, it says isolated, chronic, or occasional clearing of the throat like seasonal allergies is not concerning. So that's not what we're talking about there. All right. Next up is trouble breathing. So if you're having any kind of trouble breathing, really anything related to respiratory or breathing problems, then you should not be working. And again, you need to wait for at least 24 hours. And then finally, if you've had a sore throat in the last 24 hours, you should not be going in. Now, I will jump back up real quick with fever, where it says that you don't either have a fever or felt like a fever in 24 hours. That is without medication. So if you had a fever or you think you might have and you took a bunch of Tylenol and now you don't have a fever, that could be because of the Tylenol. So that 24-hour period is unmedicated. So you shouldn't have fever for at least 24 hours after taking medication to make sure that it is truly gone and not just the medicine doing its job. All right. And then in the past 14 days, you have not had any travel to high-risk areas. What are the high-risk areas? Well, there's a lot of them. Here they are. As you can see, that's basically just about everywhere. This is on March 23rd. So by the time you're watching this list might not even be on this document anymore. For our local protocols, pretty much as soon as Virginia hits this list, then the list is going to go away because at that point, we're basically asking people if they have traveled to where they currently are, which everyone has. So the travel part kind of becomes irrelevant. But for now, we are still using travel criteria. So there is your list. Definitely check that. That's the thing that changes almost every day. So check that to make sure it's current. You have not had any medium or high risk exposure. So, what we talked about in the last section on page 1 of this document is some exposures. And then on a later page, we're actually going to look at how we classify those exposures and what counts as a low, medium, or high risk. If you've had any medium or high risk exposure, then you should not be there. They should have told you to go self-isolate and self-care and monitor and these things. That may not last the full 14 days. If we were able to do source testing and we get that test back and it's negative, then you won't actually have to wait that full 14 days. But that's going to depend on local protocols and guidance from your infection control people. You have not been diagnosed with COVID-19 in the last 14 days. That one should be pretty obvious, but yes, if you have been diagnosed with this, then you need to not be running. And then finally, no household members have been diagnosed with COVID-19. So nobody that you live with, have close direct contact with or extended contact with. If so, then you need to be isolating yourself for 14 days also. The risk of you contracting it from them, if you're using all the appropriate precautions, are still relatively low, but we want to make sure that we're protecting our healthcare system and our patients. So you're probably still going to be asked to isolate in that case. All right, so make sure you are checking this regularly because, again, this does change all of the time. How people or how areas get added onto this list as far as the high risk areas, it's any state that's got over 500 cases or that's been designated as having widespread community transmission. For the other countries, it's anything with a level 3 notice. And if you wait till the very end of this video on the last page, we do share all of the sources for all of these recommendations. So don't feel that this is just coming from our agency. This is all straight from validated sources. But again, make sure that you are checking that and confirming that that applies to you wherever you are watching this. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.